What is chronic lymphocytic leukemia, or CLL?
So, CLL or chronic lymphocytic leukemia is a type of blood cancer. This is a cancer of our white blood cells. So, we all have white blood cells as part of our immune system, and one of those types of cells is called lymphocytes. Further breaking it down, we have these B cells, which are usually our antibody producing cells. But in CLL, a change occurs. One accumulates too many of these B lymphocytes that are dysfunctional B lymphocytes. And so it's really a cancer of the immune system.
So chronic lymphocytic leukemia is a cancer of our immune system, of our defense cells. So we have cells called lymphocytes. They are these cells that will fight infections, fight bacteria, fight viruses. They're floating around our blood. Usually they live around the lymph nodes. So sometimes you have an infected tooth. You see there's a little lump on your neck, and that's your immune system fighting that infection. So CLL is a cancer of these cells. So these cells, you have a malignant clone just arises out of them and starts growing, and then are detected throughout your bloodstream and also potentially in your lymph nodes and even in other sites. We have immune system in every single part of our body. So it's a disease that involves our immune system.
So chronic lymphocytic leukemia, or CLL, also known as small lymphocytic lymphoma, or SLL, they're about the same, and it's just a matter of distinction whether the more prominent manifestation is either in the blood or as lymph nodes or organ involvement, but use the terms interchangeable. CLL is a hematologic malignancy of the lymphatic system. It's part of your organs that involve in the production of cells that have to do with the immune defense and the white blood cells, and this is conglomerated as part of the hematologic part of hematologic disorders. So CLL is a cancer of these lymphocytes, which are B cells. They have to deal with your immune responses. Part of your immune mechanism is one of the white blood cells that are engulfed is in the total white blood cell count. It's manifested by the proliferation or clonal proliferation and expansion of these lymphocytes that will raise your total white blood cell count, with the vast majority of these abnormal B cells that are clonal. These cells lose the ability to die, and they get, they can overcome your natural defense mechanism and the, regulatory response from your own body. And when they start to proliferate, they start creating problems. They start accumulating in either the lymphatic lymph nodes, making them to be enlarged, or organs such as the spleen. They also can start occupying more space within your bone marrow, which is the factory of your red cells and your platelets and your regular red blood cells, and they start to take over and destroying the older ones or accumulating the space, causing anemia, causing low platelets, and manifestations such as fatigue. There are intrinsically non very well functional, so they can lead to recurrent infections and things like that. And those are typically the manifestations that lead to treatment of this disorder.
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take notes, and bookmark lessons. Visit the links in the description below to get started.